back. Orthopedic Surgical Partners is really dedicated to delivering superior care to patients right here in Connecticut.
Here with us now is Dr. Brian Schmidtberg. You specialize in hand and upper extremity surgery, is that right?
That's correct.
That's pretty interesting. How did you decide to go into this?
Definitely not what I was planning on going into when I started my residency, but when I was doing my training, I liked the variety that was in hand. Some of the bread and butter stuff you do, people do really, really well. Carpal tunnel surgeries, trigger fingers, so it's pretty rewarding.
But getting into the medicine field goes back to your sister, is that right?
Yeah, my sister, when I was a lot younger, she had malignant melanoma.
Wow.
And so I kind of witnessed how she did with all the doctors that were taking care of her, and kind of got me on the path, and then I found my own path from there.
Wanting to be a helpful doctor. Amazing, yeah. So, I mean, the kind of things that you can help with, people might say, maybe they injured their finger, I guess, a lot of cooking accidents, hopefully not blender accidents, but something like that, or their hands or their wrists. So many different things could go wrong, and you're the guy to fix it.
Yeah, so I've seen as silly as trying to cut an avocado and you miss and you cut a tendon or a nerve. Things I'm seeing more common now is like football starting back up, and kids are playing, you know, they jam their fingers. Sometimes they come in right away, sometimes they wait. I would say if this does happen to you, sometimes it's a little peace of mind just to get an x-ray to know that things are okay.
To know it's good, all right. My son plays, that's good to know.
Yeah, I've seen a fair share that come in, you know, 5-6 weeks down the road, and if there is a break, it's already started to heal. It just makes the process trying to treat that much more challenging.
And Brian, you've got a good bedside manner. Apparently, you know, your patients love you, and you love your patients.
Thank you, I guess. I try to take something for heart that I read when I was in med school. There was a book called Better, and one of the quotes that the author said was, try to ask an unscripted question when you're in the office.
Absolutely.
So I try not to stick to the robot script and try to ask something random. You know, how's your day? How's your summer? How old are your kids?
Yeah, that's really good.
What do you like to do outside of this?
I love that.
Well, because then you make that human connection, which is, again, that human experience is what made you decide to be a doctor, so that's great. We want you to be really good at what you do, which we know you are, but I always feel better when someone is, you know, going to talk to me first. So what's the biggest thing you want people to know right now if they hurt themselves on their wrist, their hand, or maybe they're starting to type again at work a lot and they're getting that carpal tunnel feeling?
I think it never hurts to have something evaluated, and so say a finger, it ends up just being a simple sprain. I think there's a peace of mind having somebody who knows what they're doing look at it, have an x-ray that shows that it's just a sprain. Same sort of thing if you're having issues with your fingers when you're at work, or you know, you're getting nighttime symptoms that are waking you up at night, having someone take a look at it and just tell you what your options are. Just because we do surgery, that doesn't mean that we're going to recommend surgery every time.
Right, you might do something else.
Yeah, there's lots of other conservative managements that you can do to try to make people feel better.
Can you tell me exactly what carpal tunnel is?
Carpal tunnel is, technically it's a nerve compression, and so your carpal tunnel, it's a space here in your palm.
Okay.
Okay. And I like to use the analogy that, say you're driving through the highway and you go over an overpass, and there's a tunnel that's in the overpass.
Okay.
That's what it is. It's a fixed space. Your nerve goes through there. If you have too much pressure in there, the nerve gets squished, and then you start getting symptoms that are involved with the nerve being squished, which could be tingling at night is a very common one.
Okay.
So you wake up in the middle of the night, you have to shake your hand out, you have to run it under hot water. Some people get it when they're driving or when they're playing sports where they're holding things. And if it goes on for a really long time, then people start getting actually weakness in the hand, and they start losing some of the strength in their hand.
And again, you can restore the flexibility and get it back to where it was.
If you catch it early enough, you can for sure help with these things. Sometimes if it goes on for too long, we say that you try to prevent it from getting worse. So some things you can't get them all the way better.
Okay.
But you can prevent it from hopefully getting to the point where they have permanent weakness in the hand or things that are really affecting their day-to-day.
Well, I'd like to offer you a hand, but apparently you already have several.
And congratulations on your new baby at home.
I appreciate it.
Yeah, 10 weeks old. Congratulations.
Thank you.
And a 2.5-year-old, so you know he's busy. All right, and congrats to your wife, too, yes. For more information, though, if you want to come and check one of the things out we've just talked about and make sure you're okay, ospct.com. You can also visit facebook.com/orthopedic surgical partners. Thank you so much.
Of course. Thanks for having me.
Nice to see you, Brian. Thank you so much for coming in. All right.